Good morning, everybody. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the very common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a very big concern. Acne is a common skin condition that can impact anyone, whether you are a teenager or an adult. This skin complaint is no stranger. Knowing the various types of acne can actually help you to treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just being a skin ailment to various psychological disorders such as depression, anxiety, stress, and low self confidence. Hence, it is important to know about the holistic treatment approach for this ailment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this very common skin condition and also to be aware of treatment approach for acne management. So let's connect today with our skin expert, Dr. Joseph Jenson, live from Chennai to talk on acne management. Dr. Joseph is a consultant dermatologist based at Chennai. He completed his MBBS from Chettinad Hospital and Research Institute, Tamil Nadu, and MD Dermatology from Kasturba Medical College, Manipal. His experience lies in PRP, various aesthetic procedures for facial rejuvenation, laser treatment for acne scars, tattoo removal, vitiligo, Botox, and so on. He participated in various national and international conferences. He also presented and won many papers and posters at state and national level conferences. Welcome, Dr. Joseph. It's a pleasure to have you with us.
Thanks a lot, madam. Thanks a lot for a good introduction. I've been very happy to join you on the Spotless page, FP Live. So it gives me intense pleasure, and thanks a lot for this organizing this talk. And I also thank the IPSA team also for this wonderful opportunity, so that we can share our knowledge and we'll learn about acne more.
Thank you, doctor. And the feelings are equal. It's likewise. So, doctor, as we are going to talk about acne, first of all, we would like to start with what is acne?
Yeah, acne in layman terms, madam, it is just, we just say as pimples. Actually, but it is more than that. Okay, it is not just because, since, as you said in the introduction, the mind is linked to the skin. So just now, so acne affects around, it is not, it was early considered only as an adolescent disease, but now right now it is not a disease only confined to the adolescents. It is confined to even for the pre-pubertal age or like even in children, the adolescents, and even the middle-aged people. And why not? It can affect we have seen patients affecting around 40 years. So it's a disease of varying ages. So it's a chronic disease actually. So that is what the concern is about. If it was an acute disease, it would have been just a disease where you give some ointments and it will go off. But the thing is obsolete right now. So we have to follow up the patients. So that the follow-up is very much important here. And acne is a disease of the pilosebaceous unit. That is, the pilosebaceous means hair and the hair follicles surrounding the present in the skin. So it's a disorder of the sebaceous gland. Sebaceous gland are nothing but the glands which secrete sebum. Sebum are nothing but oil-like substances which are present in our face. So mostly, as you said, it affects 85% of the adolescent people. And even what I could say is that recently around 30-40% of patients are even seen in the post-adolescent. That is even in the 30s, mid-20s and 30s. So that is how acne is. So more than the pimples, it is not only that pimples around. It can present various presentations.
Right. And you have very rightly said, earlier we used to feel that acne is something associated with teenagers only, right? When the hormone changes, etc., takes place. But now we can see a lot of acne issues with children and teenagers, adolescents, adults, and even in their 40s or 45 years of age, they are getting acne. So we'll talk about it as well. But before that, doctor, what are the types of acne lesion?
Yeah, I would like to put this in a simpler way, madam. Acne, as per se, doesn't have a single diagnosis. Actually, what we think is acne vulgaris only, but here the presentations are different. We classify the patient as either either classical acne vulgaris, or we can treat them based on the acne scars which they have. So I'll try to classify as a two types for classification. One is the acne vulgaris. We have 4 grades, madam. That is the first. We can divide into grade 1. That is the comedonal acne. Comedonal acne is more common in the prepubertal or in the children or in the adolescent age group. This comedones can be of 2 types. They are mostly non-inflammatory in nature. They can be whiteheads or the blackheads in layman terms, or we can call it as closed comedones, that is the whiteheads, and the open comedones, that are blackheads. So these are totally non-inflammatory, okay? And we have other set of lesions, that is from grade 2, we have papular lesions, and grade 3, we have pustular lesions, and grade 4, we have a lot of nodular lesions. So if the comedones are not treated, they progress to papules. If the papules are not treated, they get infected, excuse me, and they form pustules. And when the pustules are not treated, the pustules form large masses of abscesses, and they form large nodulocystic abscesses. So this is how an acne progresses from grade 1 to grade 4. And if acne is not treated from these stages, and we are more, and if the inflammation is intense, that is, inflammation sets in when the lesions are as papules or pustules or nodulocystic abscesses. So the inflammation is not treated, they either form pigmentation or they can form as scars. So acne scars also play an important role right now, because most of the patients, they just leave acne per se without getting treated, or they just leave the lesions where the inflammation sets in and they have severe implications in the skin.
Right. So we have various types of acne lesions, and it depends on what the lesion is, what the type is. The treatment, of course, will depend on that.
Yeah.
Doctor, many times we have seen, sometimes we have acne on our cheeks, sometimes we have acne, at our jawline. So does specific areas of face acne mean specific causes?
Yeah, definitely, madam. I'll just try to classify you or give a brief outline about this. See, acne can be, as in a broad classification, we can divide into 2 types, madam. One is facial acne, and that's the extrafacial acne, or what you can see as truncal acne, madam. So first of all, facial acne, I'll say the basic causes. If the acne occurs classically in the malar areas of the cheek or in the forehead, it mostly is confined to areas where it occurs in adolescent people or in the mid-20s. But there is another variant called as endocrine acne, or you can call as hormonal acne, madam. This hormonal acne is more common in the mid-20s and 30 age group, where you can see the acne, as we mentioned, that is in the lower half of the face. So any acne above the upper half of the face, we can confine to adolescent acne. Any acne occurring in the lower half of the face or over the jawline, we can call it as term it as a hormonal acne or endocrinal cause. Because endocrinal cause, what you can say is that is because of the excess androgen secretion which is occurring. So the both acne are sebogenic. Everything anyway, the sebum secretion is more. The colonization of the bacteria, that is the Propionibacterium acnes, is more. That is the same pathology which is occurring both. But the hormonal cause, what it occurs is that you find additional clinical findings. For example, you'll find hypertrichosis. Hypertrichosis means that excess hair growth may be present. Sometimes central obesity may be present. Sometimes because of the excess androgen secretion, we can find androgen, like hair loss may be present evidently. So these are additional findings which you can say that the androgen plays an important role in the acne formation that is occurring in the mid-20s and 30s. So this endocrine acne per se is also more common in a condition called polycystic ovarian disease. It is not only, it is so we can find so many females presenting in the mid-20s and 30s, especially, that can present as some menstrual irregularities, amenorrhea. So all are other additional things, and you can find other skin finding also. Cutaneously, you can find some hyperpigmentation called as acanthosis nigricans, where there's pigmentation, velvety pigmentation over the neck and over the face can be present, or pigmentation over the dorsum of the hand. So these are other additional clinical findings which will help you in differentiating the hormonal acne from the classical acne vulgaris. And one more thing which I want to talk about is the truncal acne, madam. Right now, because this is truncal acne is per se, what we think is it is due to the intense inflammation which is occurring earlier in acne phase. So if the inflammation is not treated at all, and there are a lot of differences. For example, the facial pH of the face is different and the trunk is different. The trunk lesions are also extending all over the body. So where the upper back or even the chest area or the central area of the lesions are increasing, that is the area where truncal lesions are more. So truncal lesions also play an important role, because if the inflammation is intense, they may spread all over the body, and they may start extensive scarring rather than your face.
Right. You have very well explained the, various types of acne and how various placements of acne in our face can have various different causes. Now, doctor, you have already told us about the types of acne. We have also heard about grades of acne. So, are they the same or are they different grades of
No,
acne or
madam. It
types?
is like, see, types of acne is different, madam. See, types of acne we can classify so many types. See, there are so many specific causes which can cause acne. For example, I can say that sometimes genetic factors can cause acne, hormonal causes can cause acne, drugs can aggravate acne, acne-like lesions. So there are those are some types. For example, sometimes when you use the cosmetics, sometimes those cosmetics can aggravate acne. But grades of acne is different, madam. Grades is something the clinical presentation. So clinical presentation can be very types. As I said earlier, one is comedones, grade two. The grade one is non-inflammatory. And when you grade two is inflammatory cause, where you put papular lesions or pustular lesions, where the pustular lesions are there. Or you can get the nodules, the multiple clumps of nodules can present or abscesses can present. So these are lesions where, so in inflammation symptoms, the management varies. So why we grade acne is that the treatment varies. So basically, so when you have the grade one comedones, is relatively easy to treat. For example, I can say in such that example is that when you have a plant, the plant can be cut easily, but when you have a tree, it's very difficult to cut the tree. So that is how an acne can be. And when it is at a grassroots level, you can easily cut the plant, and you can. That is how comedones are. So when the patient presents comedones, it is relatively, I won't say it is easy to treat right now. It's relatively better to treat. But when the progression and the inflammation sets on, it is very difficult for a dermatologist or even a doctor to assess the patient and treat it accordingly. So because we are not able to say a variable time. Sometimes the patient specifically asks, doctor, within how many days it will cut or so many things like that. But here the patients where we find it very difficult because the response to treatment is variable when the inflammation sets on. So that is how the grading is very different, and the grading is important to treat a patient.
Right. So there are various types as well as grades of acne, and we would like to talk about the treatment options available, doctor, for acne.
Yes, madam. Treatment options, I will try to say it in two ways, madam. Either the topical medications, oral medications, and then the procedural medications, madam. So procedure, I'll first speak about the grades, and I will speak about the topical treatments, madam. See, for grade 1 and grade 2, mostly when they are papules or when they are comedones, we will try to treat only with topicals, madam. Okay, with topicals in the sense like we will try to treat with many topical formulations are there. So we'll start with topical antibiotics when the pustule sets on or one thing. So we generally treat with either topical clindamycin, topical benzoyl peroxide, they're antibiotics for the pustular lesions. And for comedones also, what we can do, sometimes if the patient accepts, we can do comedone extraction. It's a very basic procedure. Or we can give some basic topical retinoids like topical retinoid or topical adapalene, or so many topicals are there which you can use for a treatment. But right now, in this setting, I would like to say that only a single monotherapy or single cream cannot treat an acne patient, madam. So we in combination. So combinations which are synergistic in nature, that is, one will help in one. So if you take a pustular lesion, we will give a topical antibiotic. So clindamycin can be given along with some topical retinoid. So topical retinoid will help in exfoliation of the skin or the lesions coming out of the skin. So that's better. If both are synergistically useful, that will help in treatment of the patient. And if the after the treatment with topicals, if there is no improvement, we can go for oral medication, especially if the patients had widespread pustules all over the face. Then we basically treat with oral antibiotics like doxycycline or oral minocycline can be used which is very effective in the recent times. Or even oral isotretinoin, not for infections, for the lesion present nodular cystic abscesses or large lesions. We can start with oral isotretinoin. We can start at a dose of 10 mg or 20 mg depending on the patient's need, and then we can use it for some 3 to 4 months depending on the presentation, and then we can taper it accordingly. And not only that, we may sometimes go for even oral steroids if the patient presents severe inflammation, the conditions like acne conglobata, where there are extensive nodular lesions, extensive pustular lesions, or extensive abscesses like lesions presenting all over the face or over the body. Then you have to, then there is no other go, you have to start on oral steroids even for acne. So that's how the variable presentation is, and depending on the presentation, then we treat accordingly. And these are the oral and topical medications, madam. Other than the oral and topical medications, we would like to go for procedures, madam, because any treatment is incomplete without thing, madam. See, why I say is that because the 20 years ago, I would easily say they give some cream or ointment, the patient is happy, and then they're okay, madam. But right now, why we stress on procedures is that because procedures will help in relieving the symptoms, madam. And not only the symptoms, but relieving the additional changes. For example, pigmentation. An acne can subside with hyperpigmentation, madam. So, an hyperpigmented spot is there. So, for these cases, only creams are not available, are not sufficient. For example, we may treat with azelaic acid, madam. Azelaic acid cream, but monotherapy doesn't help you a lot. So we try to do something known as chemical peels, madam. So chemical peels can be done. And even for inflammatory acne, where inflammation is intense, or if the patient wants to get it treated very, very fast, for example, if the patient has some marriage or wedding or something which is very, or the patient wants to get it very fast, then we can do the chemical peels directly. So chemical peels, for example, can be a salicylic peel, which can help in reducing the inflammation and can reduce exfoliate the skin. So the exfoliation is very well, or the pimples come out very easily, and the pigmentation is also relieved. For pigmentation, at the same time, we can do a glycolic peel or a superficial peel like retinoic acid peel, where the pigmentation also is taken care of. And if the patient has a lot of scars, then we go for all the scar treatment lasers, madam. So laser can be of ablative laser or the toning, fractional toning can be done. I prefer generally ablative laser, where we can either go for fractional carbon dioxide laser, or you can go for even radio frequency devices like microneedling radio frequencies, or even if you don't have these lasers, you can do the other procedures like microneedling devices, like we use a derma pen for treating the laser scars. And a wonderful procedure is there. What is the substitution? But substitution is nothing but the scars can be also treated with a single bevel needle, madam. So single no-car needle, where you can take and you cut the scar and you pass underneath over the scar and you cut the bands of the lesion. That also works wonderfully. So the multimodal approach is very important in treating acne, madam. That is what I want to mention.
Right. And you have again very well explained the various treatment options and procedures that can be done to take care of the acne, to manage the acne, as well as the pigmentation or scars, left behind. Now, doctor, the thing is, the practical thing that we see in our society is that when we have acne, rather than going to a qualified dermatologist, A will start, try some home remedies. B will go over the counter, ask the chemist for some, quick fix. C will ask a family or friend who had acne, or maybe they have taken some treatments, will go to the extent of, following their prescription. What's your stand on all these three? Home remedies, over-the-counter medication, and consulting a friend or family.
Madam, I would like to say this is being an alarmingly increasing, a devastating situation occurring in not only in India, ma'am, so many countries are, but in our setting, this has been why I'm saying using the word called devastating is because here when they present to a dermatologist, because of the over-the-counter medications, they use some topical steroids which reduces the condition, madam. For example, which reduces the condition and it presents with intensive aggravating. For example, the patient uses steroid. Within 5 days, it will reduce, but he will present in a florid way. It will present in a more devastating way, and it finds very difficult. The patient lands up in difficulty, madam. So, more than a dermatologist, so he has to. So we have to give medication very carefully because the skin may become irritated, the skin may become sensitive. So all of the things are occurring. So all these things are becoming a big menace for our society, madam. So what is advice, because over the counter medications, always for even a single pimple, better consult a dermatologist, because dermatologists are around all over the country. Very easily you can access any dermatologist here in India. So that if you go to foreign countries, you find difficult, but in India you can find the access everywhere. So because of the access is very easy, so you can find a dermatologist nearby and you can go for an open consultation nearby and you can ask your doubts, because asking doubts to a dermatologist, they will get your doubts clarified and they will not use these over-the-counter medications or other. And why I say the medications, one medication will be different for another person. For example, there a person, three person A, B, C, the dermatologist will try to see what kind of skin. It is a dry skin or a normal skin or an oily skin. A person A may have dry skin, so a dermatologist would have given medication based on dry skin. So if a person oily skin person would have taken for dry skin, so those medications will have the side effects. So you have to assess the condition clinically, and that's why I will say that for specifically for acne, not only for acne, a clinical diagnosis is always better, madam. So in person, if you go rather than an online consultation, because online consultation is also we don't use a hand lens, or because the distance between the camera and the clinical appearance of lesions may be different, madam. So you go to an in-person consultation where the dermatologist evaluates completely. So it's always better for the patient to get a better treatment always. So that is how it works better. So that is what we say. So I will suggest in nutshell, I would like to put that both over-the-counter medications to a friend, all these things should be betterly avoided, and meet a dermatologist in person and get the consultation and get it treated, madam. That is what I mentioned.
Right. So it's very important to go to a qualified dermat at the first place. You'll end up saving energy, your time, your money, and more importantly, your skin, your health. So please be very careful in choosing where are you going. So don't fall for quacks, don't fall for online influencers, etc. Go to the right person. Now, doctor, we always say that it's important, to take care of your skin. It's important to follow a good, healthy skincare routine to take care of your skin. Now, the thing is, again, because there's so many products available in the market over the counter, and so many influencers endorsing these products, we end up buying like 50, 100 products for our skincare, and still our skin is not, healthy. So my question to you is, doctor, what is a simple, basic skincare routine that we can follow to take care of our skin and prevent acne formation?
Madam, one thing I will say, preventing acne is very difficult, madam. See, because the sebogenic gland is very much active. Even as he said, the causes are even increasing. So unknown cause or age-related cause or even the hormonal cause, whatever it is. So basically, I can say that you can divide the treatment into two parts, madam. That is the induction, or you can say aggressive therapy. But aggressive therapy doesn't work a lot. So, however, how much ever you maintain the skin, that is the most important thing, madam. So in my treatment regimen, I will just say, as a routine, I'll just say three things, madam. Follow use at least one topical agent, but it's a combination agent, madam. So it is in the form of adapalene. Adapalene clindamycin may be a better this thing, or even adapalene can be a better option. Or even what he could say is that sometimes even benzyl peroxide. Benzyl peroxide does wonders in so many patients. So, and even if in the case of inflammatory acne, you can use adapalene and benzyl peroxide combination, or even azelaic acid combination. So these are various combinations topicals available. So try to use. I would just say use one cream, madam. At least use one cream as a maintenance therapy, so that whatever it does, though it doesn't prevent acne. See, I am not speaking about preventing acne. It takes care of the acne which is available, which is present, madam. The preventing acne is a very difficult thing. I could say that preventing acne, one thing you can use oral tablets. For example, isotretinoin can prevent acne. But the thing is that, but you can't use it for a longer time. So you have your liver parameters also in check, your lipid profile also in check. So these are some things which I would rather say that because of the parameters which you have to check and you have to evaluate, I would rather say as a topical treatment for maintenance, madam. And one more thing is that use a better, whatever it is suitable for your skin, consult a dermatologist and get a better face wash or soap which is usable for your skin, madam. See, that is what many people get confused. They come to us, they will be using X and Y, so many number of face washes, morning a face wash, afternoon a face wash, night a face wash. No, madam, that is not the trend which we would like. I would like to suggest you one face wash which is better ideal for the skin, so that will cleanse your skin a lot. So you need not even use a cleanser or even a toner, or so many things are not needed, madam. One topical cream, one face wash, and moisturizer, madam. I would like to think of moisturizer is a controversial topic in acne, because see, acne is also, which is a sebogenic agent, madam. Acne is present because of the increased sebum production. See, moisturizer, what it does, moisturizers are three types. They are humectants, they are occlusives. Occlusive prevent the water barrier getting lost, madam. And also, humectants, they absorb the water from the surrounding skin. So what I would like to say, moisturizers are not always advisable for acne, but you try to consult your dermatologist. If the skin is dry, when your skin is dry, then you have to use a moisturizer. So moisturizer is again variable. Depending on your dermatologist advice, you can use. And one more most important thing is what I suggest is sunscreen, madam. Many may think, why acne, are sunscreen, why I have to? But sunscreen is one important thing. Why? Because sunscreen prevents your pigmentation, madam. See, for your acne lesion, if it is present, that will go dark. So if you want your acne lesion to subside, that pigmentation to reduce, or even the pigmentation to stay, to even should not darken more, You have to use sunscreen, non-comedogenic sunscreen. It's better, madam. So that is also variable. So I could say we can say both organ. There are so many combinations of organic and inorganic sunscreens, depending on your dermatologist whom you visit, and depending on your skin, which is suitable for you. You can advise the sunscreen. So three things I would say: proper anti-acne agent, which may be a combination of benzyl peroxide or adapalene, or even your clindamycin. A good face wash and a sunscreen. That is more than enough. In way of preventing acne, if you don't have any comorbidities or any obesity or any other things, then some oral medications can be used. Again, you can go for ranging from isotretinoin, spironolactone. So many things are there. But I would say only if your dermatologist recommends, then you can do. Rather, I would say that to prevent acne, you can do facial laser toning, madam. For example, laser toning can do wonders. Even a procedure of substitution, if you have scars, that can do wonders. So those type of procedures are little better in reducing the acne. Your chemical peels again. You said the preventing acne. Chemical peels like salicylic peels to an extent can exfoliate acne very fast. And when you use the topicals, that may help in the environment being very stable. So you can prevent the new lesions actually.
Right. So for a regular skincare regimen, we can use a good cleanser or face wash, moisturizer, and sunscreen as must. But again, to find the right one as per your skin type, your skin issues, please go and consult a derma. They'll help you finding the right face wash or moisturizer or sunscreen. And in case you need any help or you are going for any procedures, please go to the qualified dermatologist. Again, doctor, there are so many, quacks. There are so many, again, parlors, etc., who claim to have these procedures, etc. What's your say on those? Doctor, we can hear
yes,
you. Yes. Yes,
yeah,
yes,
yes,
we can.
now I can hear. Yeah, sometimes
Yeah.
like one net.
Maybe
Yes, madam.
something.
Regarding the parlors, regarding the parlors, madam, I would really say that it brings only difficulty for a patient, madam, because they do a lot of facial. See, one thing which I like to do, say is that when you are on acne treatment, especially they go for bleaching, the bleaching of the skin or something, that is very detrimental to the skin, madam. Why I say? Because they are some strong irritants which can cause a lot of eczemas to the skin. When they go for acne treatment, they invariably end in eczemas, and we invariably have to treat the eczema. So when we treat the eczema part of the skin, it becomes very difficult to treat the acne per se. So the acne lesions also increase. So it becomes a double-edged sword for us. In fact, it still increases the burden for us in treating the patient, madam. So what I would say is that parlors, you can go for your regular testing, but when you are on acne treatment, don't go for any specific bleaches or any other specific this thing, madam. So that will aggravate your skin condition. I would say that skin barrier is lost. Your tendency to get irritated, the skin irritation tendency is threshold is reduced. So the skin get irritated easily. Skin becomes sensitive. Again, I would say, madam, sensitive skin is a very big hazard for us. Why? Because you can't even then, for example, a patient A who has been using a topical, he gets a bleach done, the skin is becoming sensitive. It becomes more difficult for us to treat the sensitive part of the skin. So you can't even use one topical agent for him or her. That becomes the redness sets in, erythema sets in, and ultimately it turns into a dark spot, madam. So that is what the part is. So don't go for bleaches. If you are on some treatment on lasers or something, even if you get, because why I am saying this, that some patients even go to parlors for laser hair removal. So laser hair removal is one thing which has been which the parlors are doing left and right now in the practice. So the patient would have been on topical treatment. He would have been on laser for acne scars. So next 1 week he'll go to a laser hair removal, and if you get it done, that will aggravate. Again, when the hair is removed, you will have a lot of burning sensation or an irritation sensation over the face when especially when the upper lips and other cheeks area where the hair are removed. So that creates a very big difficulty for the patient itself. More than a doctor, it keeps your skin sensitive, and the patient can't attend any functions. If he or she has to go to any functions for nearby, the skin is becoming sensitive. So the patient is it becomes a big hazard for the patient. So I would say one point such that don't go for any procedures in your parlor. You can go to parlor. You can get your basics done, like hair removal. Also, I'm not saying if you want the thing they are getting it done because you have to get it done from only from dermatologist, the hair removal. But invariably, many patients turn into the parlors. So we can't prevent the patient going to parlor. So that is one thing. But even if they go to parlors, avoid a procedure, rather than a basic procedures like a pedicure or manicure or a haircuts, that is fine. But when you go for bleaching and all, that is very difficult, madam. It becomes the patients only face a lot of hazards there.
Right, fair enough. And doctor, diet seems to play a good role in acne management. Is there any science behind it? If so, what kind of diet?
Definitely, madam. I would like to, yeah, madam. I like to say so much important things about diet. See, one thing, madam, diet, first of all, why diet is important is that diet plays a major role in every age group, madam. For example, children, they used to consume a lot of milk. Even the parents give a lot of milk on chocolate products where that increases acne, madam. They are all sebogenic because milk per se contains a lot of casein and all other proteins, madam. So all these whey proteins, all these things, what they do, they increase the sebum production and thereby acne increases. Number two, especially when it comes to adults, like in middle-aged people, like 25 years or 30 years, what you do that they all consume a lot of high glycemic index products, madam. So glycemic index is nothing but it is one thing which is alarming because your carbohydrates, the carbs keeps up acne increasing. So when you consume a lot of foods with high glycemic index like your ice creams, your chocolates, or your milk, or even all these things invariably increase acne, madam. So when your carbohydrates are increasing, the metabolism of carbohydrates is so difficult, thereby it increases the acne. And number two, any foods that increases the insulin growth, IGF level, that is insulin growth factors, they are also producing because insulin growth factors also, or insulin resistance, as I said in PCOS, they also increase your acne. So any foods that increase the insulin resistance, all your diabetic foods, all are, I would say in nutshell, that any foods which increase the sugar levels are ought to be avoided in acne, but because they also aggravate the acne, they also have the hormonal cost being increased, and so the insulin resistance is increased, the acne is also increasing. So that is what I wanted to mention. So foods with high glycemic index have to be definitely avoided. But in the same time, then you are saying, then what can be taken, doctor? I would suggest you to take omega-3 fatty acids, for example. There are substances such as, because they are not consumed everywhere, they are available as fish oils and capsules that can help in stabilizing the barrier. That can help in reducing the comedogenesis. All these things can be taken. And some foods, for example, fruits can be taken. High fiber diets can be taken. And even protein foods can be sometimes taken because though high protein levels or your anabolic steroids, the proteins containing or the testosterone steroids, so many people would have been taking some testosterone foods, their foods increase in anabolic steroids to gain the weight. So those are the foods which are again increasing the acne. So you can avoid those type of proteins, and you can take a lot of animal protein or even vegetable protein which is available. So that can help in reducing the acne, madam. So that's, and even some foods like buttermilk, I could say buttermilk contains a lot of lactoferrin. So lactoferrin, what it does, madam, it is, though it doesn't contain the casein and other, though milk contains a lot of this thing, buttermilk can help in reducing the acne production for the sebogenesis. So that way it can also help in this thing, madam. And other foods like papaya, all these things. In foods are very good ingredients, madam. They help in reducing the oil production or the sebogenic production. So that way it counteracts the acne production, madam.
Wonderful. And doctor, I'll take some of the questions that our viewers have asked. So Advik Singh is here. What are the potential side effects or risks associated with acne medication?
Okay, madam. I would like to say in a nutshell about this. Acne medications can be, as I mentioned in my talk, they can be clindamycin, topical. I will say about the topical medication first and the oral medication next. Clindamycin, benzoyl peroxide, topical retinoid, so many things are there. One thing is, madam, the correct use, madam. I would say, I say to my patients, whoever it is, it may be a sensitive skin or oily skin, apply in an adequate level or an optimum level, madam. I would like to say this word optimum because many patients, they think that the acne is extensive, so apply more amount of the creams or topicals, then the lesions will reduce. No, it is not that lesions will reduce in 1 second or 1 day, madam. It's a pathogenic process which is occurring for so many days. So we need to keep the maintenance therapy wide apart. So the interval should be wide apart to treating. So I like to say the ointment should be used in a very mild amount. If used excessively, number one, it can cause sensitive skin. It can cause erythema, redness. It can cause, so when the erythema is untreated, then they go for hyperpigmentation. And one more thing is that when the cream is improperly applied or when it is applied in the early mornings or when the sunlight is evident, they can go for phototoxic reactions. But when you go out, exothermic reactions can occur, and that may form increased pustular reactions or increased sensitivity of the skin, increased itching over the skin. So many side effects can inadvertently occur when you apply the when you apply the creams in the morning. So these are one of the side effects. And one more thing, excessive dryness can be another important side effect, because we see acne in a oil rich or oily based. Most of the acne patients come with oil rich skin. So when these all the acne topical products are sepostatic, sepostatic in a sense, like they'll try to reduce the oil products. So when the oiliness reduce, then invariably they'll result in dry skin, madam. So that is why we mentioned any dry skin patients, we don't advise the patients to go on sepostatic over-the-counter medications, because then they turn into a dry skin and sensitive skin, and it will be more flaky in nature, and invariably it will turn into a lot of side effects, madam. So these are the more common side effects which we use. One more thing which I want to mention is that many over-the-counter pharmacies, they'll give retinoid cream or over the retinoid creams very easily. The important side effect of retinoid cream is that it can cause something known as retinoid dermatitis, madam, or it means that retinoids can aggravate the eczema level, or it can cause a kind of irritant reaction to the skin. So retinoid dermatitis is one thing which you have to be very aware of. So we consult a dermatologist only when a dermatologist ask them to see if a dermatologist is given, and then they would have if the patient develops retinoid dermatitis, it's fine, because then the dermatologist know how to treat a retinoid dermatitis. But if it is applied over the counter, the patient may be unaware of the treatment. So because of the unaware of the side effects may predominantly aggravate, and finally they lead into some complications, like pigmentation or intense scarring. So that will lead into a lot of complications. So retinoid dermatitis is very essential. So the dermatologist will advise, and we treat it accordingly, madam.
Okay, doctor. We have one more viewer, Sonam Sarathe. Her question is, can I wear makeup while treating acne? Are there any specific products I should use?
Madam, actually, I would say that makeup should be actually, I would say makeup is one good thing, madam. Why I say one good thing is that, see, there are so many patients with acne scars, madam. When acne scars, makeup that's a good way, in such a way that even our classification of acne, the Goodman and Barron's classification of acne scars, mentions that a makeup can prevent the patient, or even it can reduce the visuality of the scar. So that's how wonderful a makeup is. So makeup can reduce the visuality of the scar. So in that way, the moderate, though if it's a moderate or the severe scar, when the makeup can't reduce the visuality of the scar, then it is difficult. But for a mild scar or a macular scar, when the patient presents with, makeup does a wonderful thing in reducing the visuality of the scar. I would say in that way. Second thing, madam, what I want to mention is that, but the makeup is not free of products, madam. I could say that they allow a lot of lanolin products. Lanolin is one more product which can aggravate your skin eczema or your allergic contact dermatitis. They are not free of petrolatum. So avoid your makeups containing of lanolin, petrolatum, or other cosmetic agents, madam. So the agents which are increasing the cosmetic acne. So all these things have to be avoided. And anything which some moisturizers with the patient will be using, where they will be containing some white petrolatum, liquid paraffin, all these things. So these kind of moisturizers should be definitely avoided, and especially urea containing moisturizers, because sometimes inadvertently urea will be hidden in the makeup products, and that may aggravate your this thing. And your pomades, which some people will use their pomades using for a hair cosmetics, that should be avoided. Pomade should be avoided. Your makeup should be free of lanolin, white petrolatum, and all these fragrances, and all the other makeup items. Which foundation can be applied basically, madam. But other than the foundation, we have other products which they'll have the and right now which we face all the serums, madam. I would say not in every serum, but patient in n number of serums are added, madam. They'll use a retinol serum, they'll use a niacinamide serum, they'll use some vitamin C serum, they'll use some X and Y n number of serums. So all these additional serums, madam, with the makeup, they make the makeup more. The makeup will try to cover the skin, but invariably they will lead into some complications, madam. They lead into so many acneiform eruptions, so many increase in acne, so many sensitivity of the skin is increased. So this leads into so many side effects. So I would say that in a nutshell, I would say makeup devoid of lanolin, your petrolatum, all these things should be avoided. Your foundation can be applied to a minimal level, madam. That is it. But other than that, your every cleanser, toner, X and Y serums, I would say, even if you don't apply serum, that's better, madam, because Serum doesn't provide your additional edge of giving the extra thing rather than complicating the existing thing, madam.
Definitely. And doctor, any closing remark for our viewers before we sum up the whole session?
Closing remark, madam, I will say a few conclusion points. I'll say 3 to 4 points. Number one, acne is one condition which is very distressing right now. But why I say your mind is very much important. Don't get into the stress of acne, madam. See, you have to make up the mind that the lesions will be persisting for some time, madam. So you have to keep the mind, since your psyche is linked to the skin. I would say that don't ever involve in a complicated psyche or a depressing, anxious. Don't be anxious or don't be getting depressed. Just follow your dermatologist order, madam. And whatever any complication from the dermatologist occurs, the dermatologist will manage it, madam. So don't worry about it. Avoid over-the-counter applications or over-the-counter. Especially, I am very much worried about the Instagram influencers and Facebook influencers, madam, because these are the people where they guide the patient wrongly, madam. So when the topical, so many products have been applied in some 4 to 5 products or 10 number of products are applied, and when you change the products, it is very difficult for a dermatologist to identify which product has caused that aggravation, madam. So don't use any n number of products. 1 or 2 products, one sunscreen, and as I said, one sunscreen, a sunscreen combination moisturizer, or even a face wash, or even a mild cleanser, and even an anti-acne agent. That is better for an acne. And if needed, oral medications can be taken, madam, under the discretion of the dermatologist. That is fine. So nothing to be worried about it. So don't worry about all the complications. Anything can be treated. Even if the pigmentation presents, you can treat the pigmentation. But even if the scar is present, you can treat. But don't overthink and don't think complicated way, and don't get depressed or don't be anxious, madam. That will reduce the treatment efficacy, madam. That is what I want to mention.
Right. Thank you so very much, Dr. Joseph. It was wonderful talking to you. This was a very informative session. Thank you so very much once again.
Thanks a lot, madam. Thanks a lot, and thanks to the IPCA team for organizing this.
Thank you. Thank you. And viewers, thank you for your active participation. For more updates and details, you can keep following Beautiful Spotless Skin page. Stay happy, stay healthy, stay spotless, and keep glowing. Thank you. Have a good day. Goodbye.